What's happening, guys and gals? Welcome back to my channel again. I'm Cemil Turan, and today I'm gonna discuss the high hematocrit and deep vein thrombosis associated with it. So, in those fitness world or fitness industry, most people obviously use androgens or in general use PEDs that directly or indirectly can or do increase the hematocrit, hemoglobin, or RBC levels. So obviously with high hematocrit, you can easily, much more easy, you can get blood clots much more easier than a regular or average person. So some people, for example, for equipoise or baldinone, they cause the phenomenon, they call a phenomenon, they talk about a phenomenon called thick blood. And you may think about, what is a thick blood? A thick blood is a blood that has hematocrit levels over roughly 50, like 50, over 52 is an alarming level, unless you're using a high hematocrit level, high RBC count for cycling purposes. For if you're a professional cyclist in Tour de France, you might benefit from it, but there is no free ride. Obviously, you can get blood clots much more easier, especially when you're dehydrated and you might literally die in your sleep. So there are potential risks for blood clots. Obviously, the potential risks are high hematocrit, high fibrinogen, high platelets. Those two have role in clotting process. And dehydration, obviously, if you're dehydrated, your hematocrit count will increase because the hematocrit is the RBC count in total blood. So obviously, smoking, if you're smoking, you can get blood clots much more easier. And also, keep in mind that blood donation is the last resort because frequent phlebotomy may cause iron deficiency. Most people forget about that. They donate blood in their cycle every 4 weeks. Or technically, unless you're living in a third world country, you cannot, I repeat, you cannot donate blood unless it is the last time you donated is like 12 to 16 weeks ago. And even in some countries, it's 20 weeks. So a very low RBC hemoglobin and hematocrit levels can increase your endogenous erythropoietin, which is the hormone that tells your bone marrow to produce more red blood cells. And that process is called hematopoiesis and erythropoiesis. So, low levels can simulate EPO, and thus it might create a vicious cycle of high or increased hematocrit that has previously caused by low hematocrit. Obviously, you do not want that. So the phlebotomy is a last resort, but if you overdo it, your body obviously has defense mechanisms. So your body might compensate it by increasing the EPO levels, your endogenous EPO levels. So you might check my previous videos. I've already talked about how ARB saves lives. And also, low-dose aspirin may help you prevent blood clots on your cycle. But aspirin technically does not thin your blood. It is a cyclooxygenase 1 inhibitor, and via cyclooxygenase 1 inhibition high enough, it irreversibly prevents your platelets to lose its clotting potency. So it makes coagulation much harder. Technically, it does not thin your blood. So there are other drugs that increase your deep vein thrombosis risk. So those are obviously SERMs, like tamoxifen, which is used in hormone-sensitive breast cancer positive females, in breast cancer positive females. It acts like an estrogen or anti-estrogen depending on tissue, but it increases the deep vein thrombosis. Also, the synthetic progestogens used in birth control pills, also ethinyl estradiol, which is something you can easily find in almost every oral contraceptive medication on the world. So there are many powerful tools that we can use to prevent high hematocrit count and prevent deep vein thrombosis. And those powerful tools are subclinical dose ARBs or ACE inhibitors. If you use or abuse androgens, you should, for performance enhancing properties, you should already be on an ARB or ACE inhibitor, no matter what. But the dosage shouldn't be that high or clinical, and even if you're not hypertensive, you should probably use subclinical dose ARBs or ACE inhibitors. Also, IP6 supplement is a powerful tool that can decrease your RBC and hematocrit count. But keep in mind that be careful because IP6 can easily deplete your iron levels. So if you take a look at how your body, what hormones have influence on hematopoiesis process, and the hormones are thyroid, your testosterone, EPO, B vitamins, B12, iron, etc. So low and intensity static cardio is a great tool because it's an activity, and activity obviously decreases your deep vein thrombosis risk. Do your cardio however you like. It might be low intensity assault bike. I know it sounds ridiculous, but elliptical bike, rowing cardio. If you're a rowing machine, you can do a cardio on that. A stepper, incline treadmill, or weighted waist walk on an incline treadmill, or even swimming. Do whatever you like. And you might use precautionary aspirin under a doctor's supervision. You are more likely to develop thrombosis when your blood is more viscous, like a pudding. Aspirin does not lower that blood's viscosity, but it delays coagulation. And just be a good guy in general, or a gal. Donate blood before beginning your cycle, and tell your mama, what a good boy you are. Just be a good boy. Blood donation should be your last resort, but just one donation before your cycle, unless you're anemic, is a really good thing. It saves lives, right? Also, sleep. I almost forgot that. Sleep. Sleep in a well-oxygenated, cool room. Have you ever wondered why sleep apnea patients have high hematocrit? You might have wondered that. They literally suffocate when they are in sleep. And after a minute or so, they wake up gasping air. And if you have sleep apnea, do whatever you can do to prevent negative health outcomes. If you're especially over 20 to 25 body fat percentage, just lose some weight and mostly body fat. Use body fat. And if you have even sleep apnea, use CPAP machine. And nowadays they are almost dirt cheap compared to what they were 5 to 10 years ago. And if you're smoking, just stop it. The health benefits of quitting smoking are not only limited to hematocrit control and decreased deep vein thrombosis risk. There is almost no disease that cannot benefit from just quitting smoking. And that's pretty much it, guys. If you like this video, please don't forget to subscribe, share, and leave a comment. Like. Don't forget to like it again. And thank you so much for watching it, guys. Also, till next time, take care and have a great day.